Hi friends, welcome to Vinitha online nursing classes. As a part of our classes, today we are going to discuss the topic evidence-based practice from the subject nursing research, which is useful for the B.SC Nursing 4th year students. Let's discuss our topic evidence-based practice. See, evidence means general word. The meaning of the evidence is knowledge. Just remember that the exact meaning of the evidence is knowledge. The term evidence means knowledge. Means the knowledge we can able to gather the information, the knowledgeful information that we can able to gather from different kind of the variety of sources. Whatever we are gathering the information, so the content, the text, the gathering of the information that should be in a particular skillful and knowledgeful. This evidence based nursing, so this before performing into the practice, so generally they used to call it as a evidence based nursing. Evidence based nursing was started in the year during the period of the Florence Nightingale, so year 1800s. During the year of the 1800s, with the cooperation of the Miss Florence Nightingale. Coming to the evidence-based practice, generally many of our professional practices, or like not only our professional practices, especially nursing, medicine, psychology or the psychiatry, we are having the periods in our past which we are practiced based upon the loose bodies of our knowledge. Some of our knowledge was simply draw upon based upon our experiences and the past generation experiences of the professionals. Nursing practices are generally based on nurses' past experiences. See here, there is a little scientific evidence to support the nurses. Like clinically, while clinically they used to make one of the decision making and expected outcome. While nursing practices which is based upon the research evidences that will be contribute to achieve the client outcome and making nurse practices more and more, so that we the nurses need to base our practices on such kind of these kind of the evidences. To why we have to show the evidences, mainly to optimize the client outcomes or to provide the cost effective safe practices to enhance the credibility of our nursing care. So this is the main introduction, how the evidence will be having during the nursing practices, during the nursing clinical procedure. See, 1800s, with the help of the Florence Nightingale, Miss Florence Nightingale, so they doesn't frame that it as a evidence based practice. They have concluded that evidence based nursing, because during that period there is a excessive care of the nurses, excessive working environment was provided by the nurses. Evidence based nursing is a problem solving approach to clinical decision making, is a continuous interactive process involving the patients, involving with the some other people or like community, society, for the best available evidence to provide the care. It is one of the practical guide for us. For the nurses, EBN is a practical guide. Not only for the nurses, so EBN, when we are going for the evidence proof context, it is also one of the practical guide for the students. those who are working in the medical and the nursing streams of the professions and nursing practitioners. By these step by step, it will be enabling the nurses to understand and evaluate the different types of the evidences which are that available for our study. It also considers many of the findings like implementation of the clinical practices, how research we can able to show the practically. So these are the, if we discuss more about the introduction of the what is the duration and when it was started and what is the focus of the evidence based nursing. So there is a lot of concept, lot of the introduction part regarding the evidence based practice and the evidence based nursing. Evidence based nursing was started in the year 1800s. Then along with that, evidence based medicine, along with the evidence based nursing, evidence based medicine was started in the year 1980s. So here completely providing the medical care like scientific evidence. The medicine, evidence based medicine should show the particular scientific evidence, particular practice, particular recognition of that procedure or practical care. Here coming to here, complete service which was provided by the nursing care. Let's see the definition of the evidence based practice. See here, EBP, evidence based practice in nursing is a process of locating, appraising and applying the best evidence from the nursing and medical literatures to improve the quality of nursing, to improve the quality of clinical nursing practices. So let's see the exact meaning of the this kind of the definition. See here, in nursing only we used to see in the evidence based practice, our study should be particular evidence-full. So with the knowledge-full we have to perform whatever we are going to perform the procedures or such kind of the practices, that should be in a knowledge-full manner. So this is the evidence based practice. See here, it is in nursing, it is a process of locating. What we are locating? We are locating either it may be patient care or either it may be such kind of the knowledge or either it may be research. Appraising. So whatever the knowledgeful content we are located, so that content, that knowledgeful practice should be appraised and applying with the best evidence. Applying with the best evidence from the nursing and medical literatures. So only that should be applied by the nursing and the medical literatures, means either we can able to take the knowledge, take the evidence from the nursing or medical literatures to improve. Why we are focusing only these two means, so what is our goal? Patient outcome is our goal. So if we take these kind of the proper situation, then only we can able to see the particular quality of clinical nursing practices. So by taking these kind of the evidence from the nursing and the medical practices, only we can able to improve the quality of clinical nursing practices. So this definition was according to the Suresh K. Sharma. This definition was according to the Suresh K. Sharma. Evidence-based practice in nursing is a process of locating, appraising and applying the best evidence from the nursing and medical literatures to improve the quality of clinical nursing practices. So here, as a nurse, as a researcher, whatever the procedure, whatever the kind of the practical, whatever kind of the care you are going to perform, that should be evidenced by the medical and nursing literatures. Literatures means which already have been established by a greatest authors or the greatest experts, so scholars, philosophers. By that only we the nurses can able to gain the knowledge. So this is the definition. Then coming to the purposes of EBP, purposes of evidence based practices. So here the main aim of the EBP, like mainly especially the EBP will be focusing on the nurses to manage the exploitation of the new literatures and technology. The ultimate goal of this one will be resulting in only in the outcome of the patient, means patient outcomes. This kind of the EBP will be always allows the nurses to enrich their knowledge, enrich their clinical training, like experiences with the up-to-date knowledge, with the large amount of the research and the information. So whatever the existing in the nursing, like learning skills of the evidence-based practices, that will be allowing to search for such kind of the assessing the patient or applying the literatures like clinical situations. So for that, to apply the clinical situations, there are the some purposes of the evidence based practices. The first one is to eliminate unsound or excessively risky procedures. So here, why here nurse should eliminate unsound or the excessively risky practices means, so here what is the main goal, what is the main goal of EBP? Outcome of patient, the patient outcome should be, result should be in a good and excellent manner. So if the nurse is ready to take the excessively risky practices, so either it may be patient outcome is good or bad, whether it may be good or bad, but it will be having such kind of the problems. There is a raising of the problems towards the nurses or towards the researchers. So that's why the main purpose is doesn't taking the to whatever the unsound, whatever the excessively risky procedures will be coming, that should be eliminated by the nurse or the researcher. Then coming to the second one, to provide highest quality and most cost effective nursing care. Like see what is the provide cost effective nursing care, to fulfill our nursing care possible. So what is our nursing care, what is our goal? For the patient outcome is our goal, to fulfill our nursing care in a higher manner with the nursing expertise, preferring the individuals and the families and the communities who are coming under their who are having the relationship within the patients or relationship with our samples. So if we are giving the quality of the care, then there should be in a proper outcome, the outcome should be in a good manner. So these are the two purposes of EBP. Then coming to the next purposes, to contribute a lot towards better patient outcome. See here what the nurse should contribute, she should try very hard, work very hard. Why she should try a lot towards better patient outcome? So if she work hard, if she do lot of patient, lot of care, if she give lot of care to the patient, then our patient outcome should be in a, it will be in a good manner. Then fourth one is the to specify the way in enrich. So here spelling mistake, enrich professionals or other decision makers should make decisions by identifying such evidences. See here, to perform such kind of the program or to perform any organization, see for example if you are going to conduct one of the meeting or one of the program in our college or the institution, so what is our goal? So only one person can't able to take all the responsibilities. So what the person can able to do, like he used to put one of the organizer, so to conduct, you are the organizer to conduct this kind of the program. For example, imagine that on April 7th we have to conduct World Health Day. So every year with the help of the World Health Organization, so April 7th was considered it as a World Health Day. So for example, I am going to convey to our students. So on the day you have to conduct as a nursing student, as a part of the medical professionals, as a part of the medical students. So you have to conduct such kind of the health awareness program on April 7th. So I have given one responsibility to one of the person in our college. So what is her duty? So she should not take any decision alonely. So she have to mingle with the people, she have to take each and every decisions in the group. Then she, after that taking the decisions of all her colleagues, then immediately she will be approaching towards the higher authorities like a faculty or the administrator, institution administrator. So here why I am why I have chosen that decision making means, so here to specify the way in which professionals or other decision makers should make decisions by identifying such evidences. See, the each and every person will be making the different kind of the decisions. How the people are making the decisions? By identifying such evidences. There is a, so last year what we have conducted, same program we have conducted, this kind of the error has happened, this kind of the positive way, this kind of the negative way, this kind of the positive people are having the opinions. So see here how the people are conveying by seeing such kind of the evidences. So these are the purposes of evidence based practices. Then coming to the next steps of evidence based practice. So students don't confuse. So either they may ask, write the steps of evidence based practice, or what are the steps for process of evidence based practice. The question is same, question is similar, just here there is a process. What is the process? Just in previous slide, just steps of evidence based practice, we have seen the steps of evidence based practice. So here process, steps for process of evidence based practice. So here coming to the steps for process of evidence based practice, so there are the majorly 5 steps. So let's see what are those steps. So whatever, if we need the particular, if we want to gather the information step by step, if we take step by step decision only, we can able to perform, we can able to achieve our goal. So if we are not at all following in a scientific manner, so step by step means it is a quantitative manner. So we are following with the quantitative research, we are not at all following the qualitative research. Means qualitative research means, so either the researcher can able to perform first step, then if he doesn't have the interest towards the second and the third step, then immediately the researcher can able to jump into the 4th step. So see here, steps for process of evidence based practice, mainly it is divided into the 5 steps. See, let's see what are those steps. Step 1, see here, step 1, formulating a clear question based on a clinical problem. Formulating, so it is the first step to select the topic, like ideas which will be coming from the different sources. Again it will be so here we can able to gather the information from the different kind of the sources. So what kind of the sources? To mainly to formulate a clear question, first step. So before formulating a clear question based on the clinical problem, so researcher or someone else or the nurse should select the topic. First, what is the step? Formulating a clear question based on a clinical problem. So to formulate a clear question related to clinical problems, so to formulate that question, so here selection of a topic will be included. So how the selection of the topic? So here only focusing the clinical problem. So generally if we see the only clinical, then what about the community, then what about the some such kind of the other activities or other organization? So here the selection of the topic will be coming into the 2 steps. See, let's see what are those steps will be, what are those broad classification will be, see in the next slide. See here, formulating a clear question is characterized into the 2 broader classes. For what is our first step? Have to select a topic, particular topic. Coming to here, how we can able to select? So what is the step? Formulating a clear questions which is based upon the clinical problems only. Based upon those clinical problems only, we have to formulate a question. So if we select only the clinical, then what about the different kind of the activities? So here, so that they may be divided into the 2 classes. The first one is the problem based sources. Problem based sources means either it may comes the clinical problems may come, like financial problems may come, like health, some such kind of the family problems may come. So different kind of the problems may come. So here not only focusing on the hospital based, so here the community people will be involving, the rural area people will be involving, urban area people will be involving. Such kind of the different kind of the peoples will be involving in the problem based structure. So here in this category, we the healthcare professionals will be having an idea about the relevant questions for the evidence based practices. From the relevant questions will be from the clinicals, like clinical practices like assessing the data. Such data will be having the quality improvement, like benchmarking data, financial data, recurrent clinical problems. So here, like not only the such kind of the assessment program, so here the researcher can able to gather the information data from either it may be benchmarking data, either it may be finance data, either it may be something knowledgeful data. So that should be only the problem based source. So this is the first step. So here, for example, just imagine that example: increased incidence of pressure sores in critical care units. What is the problem here? Pressure source. Pressure source is the problem, where they have admitted, the patients were admitted in the critical care unit, CCU. So here problem based source ma. Increased incidence of pressure sore in critical care units may be one of the important issues to be considered for the evidence based practice. See, we are having the particular evidence regarding these kind of the source. What source? Pressure source. The people who are suffering with the pressure source, the incidence was increased more than the expectations. The pressure source patients was increased day by day. So by that increasing of the incidence, they were admitted in the critical care unit. So it is the most problem based source. So we can able to, the researcher or the nurse can able to show the such kind of the evidence for the problem based source. So this is the first one, problem based source. Then coming to the second one, knowledge based source. So here the knowledge, the word itself says the meaning, knowledge. So whatever we are giving that evidence or whatever we are giving the topic or such kind of the information, so that will be completely based upon the knowledge. So here coming to we the healthcare professionals, we are having such kind of the obtaining the knowledge of the newer evidence. See, nurses or someone medicine, those who are studying medical professions, doctors, those who are having the philosophers, they used to update their knowledge with the newer evidences from the scientific journals or the publications, like the conferences or EBP meetings published by the sanctuary bodies or the any institutions, which will be enhancing only the nursing care practices. So here knowledge based means the we will be choosing the persons, philosophers or the scholars or someone else. How they can able to get the knowledge? By attending such kind of the conferences, by reading the books, by reading the such kind of the journals, articles. So there are the many of the sources to gain the knowledge for the nursing professionals, health professionals, like practitioners, students, medical professionals, doctors, psychologists, scholars. So by they can able to gain the knowledge by reading such kind of the scholars. So this is the knowledge based question. So here see an example. I am telling one of the example. New evidence on nursing care interventions. So what they have find out, new care of nursing care of intervention regarding the pressure source, pressure prevention of the bed sores. So here in problem what we have observed, there is a increasing the incidence of the pressure source, bed sores. Then immediately they were admitted to the CCU, critical care unit. Coming to here, knowledge based sources will be having the what they have identified, they are identifying, they are updating their knowledge with the newer thoughts, newer ideas, newer updates. So here with that newer updates, so they will be finding here new interventions. So they have find out the new interventions to prevent the bed sore, so to prevent such kind of the infection control. So this is the difference between the, this is the difference or the classification or the broader classes. This is the two broader classes. See, problem based means completely problem, focusing on the problem. Coming to here, knowledge means knowledge, completely focusing on the knowledge. See, for example, right now the current situation is COVID-19. So here coming to the problem based structure, for example, increasing. See, today there were cases were they were increased, almost 250, around 250 cases was found in Telangana state. So here what we are focusing, problem based source. So here increasing incidence of COVID-19 positive patients. So if we have observed what the government was observing, there is a increasing the incidence of the COVID-19 patient, then immediately where they were shifting to the quarantine for the 14 days. So this is the problem based sources. Then coming to the second one, so already first step what we have observed, incidence was increased, the COVID incidence was increased. Then coming to the second one, knowledge based sources. So see how many, from few months they were suffering with the COVID, the one of the virus was infected in a different types of the worldwide, the people were suffering with this kind of the virus. So here to find out those medicine, to find out the what is the exact treatment for that medicine, so many of the scholars will be reading to gain the knowledge. So they used to search, they used to conduct the research, they used to study such kind of the books or the articles to gain the knowledge. So here what just we have hearing just in a peripheral manner we have find out such kind of the medicine. So here what their plan, knowledge based. So here the nursing care interventions and prevention of COVID-19, infection control of that COVID-19. COVID-19 prevention means, so preventive measures, what are the preventive measures we have to take? So like hand washing technique, like putting a mask to the face, so we should not touch our face, hands towards the face, and we have to wash the hands in a proper according to our proceduric manner. So what are the steps? Palm to palm, forehand to forehand, finger to finger. Then coming to here, wrist, so till the end of the elbow. So we have to, so see the government or the many people were telling regarding the hand washing. To see here prevention of preventive measures they were telling regarding the particular problem based solution. So here this is the problem based solutions. So problem based sources and the knowledge based sources, these were categorized by the two broader classes. The first one is the whereby first we have to select the topic. So here selection of the final question of the EBP, that requiring the brainstorming about ideas. So here we can having the different kind of the ideas like disorder of the patients. It must be ensured with the multidisciplinary team. So with the taking of the multidisciplinary team only we can able to perform the such kind of the information to take a particular step, particular evaluation, evidence based nursing practices. So this is the first step of the evidence based practice. Here in this first step to select the topic, so there is a one acronym, one word, how we can able to select the population or how we can able to select the topic. So there is a one word acronym. Let's see what is that word. See here there is a one word acronym, ACRONY, acronym. So see, so one of the meaning, so what is our focus must be there. So first one is the P, how we have to select the topic. First one is the P. P means patient. Second one is I. I means intervention. First one is patient, second one is intervention, and the C is comparison. C is comparison. Then coming to the O is outcome. See, let's see what is the acronym. P PICO, PICO. So by this method, by this possibility acronym, we have to remember, we have to put this acronym in our mind, then we have to follow. So first, write while formulating or selecting a topic, by formulating a clear question which will be based upon the clinical practice. So first, what we clinical problem, so here we are telling that it is a clinical problem. So here selection of the patient, or what is the patient condition, and who is the patient population, then coming to here, so here we came to know that who is the patient population. Coming to here, intervention. So what is the potential intervention, for the patient? See here, which patient we have observed? COVID-19 positive patient we have observed. So which kind of the intervention should be required for the COVID-19 patient? Got it? Then coming to the C, comparison. So here we have to observe the comparison, means see there is a little comparison between the patients and the healthy persons. So here, is there a comparison intervention? So is there any comparison towards the interventions, our intervention? See, after giving our interventions, our treatment or our intervention for the patients, so we have to observe, is there any comparison intervention? So after giving our intervention like a treatment or something else, so we have to observe that it is a how was the comparison towards the before intervention or the after the intervention. Then coming to the O means, so after giving the intervention, almost the patient may get the proper well-being, proper healthy status. Then desired outcome. What is the desired outcome? We have to see that what is his or her desired outcomes. See, once again I am repeating, PICO. P means patient. So here we have to observe that who is the patient population. What is the patient population? Example, I am taking right now the current situation, COVID-19. So who are the patients here? COVID-19. Then coming to here, so we have to give the potential intervention for the COVID-19 patients. So generally potential intervention means, first they used to observe, they used to check, and they used to send for the culture and the sensitivity. Then later on they will be having in a 14 days quarantine position. Then coming to the C, so see, we have to, as a researcher, as a nurse, we have to observe the comparison of the intervention. So after my intervention, after my treatment, is there any changes in the patient? Then what is the desired outcome? So this is the PICO we have to remember while collecting or selecting the first step of our evidence-based practice. Then coming to the second step. What is the second step? Literature review to search best available evidence. So already I have told that what is mean by literature. So the literature means which was the books or the established by the experts like scholars or the philosophers regarding the such kind of the study or such kind of the organization. So whatever they have conducted the study on the topic, on the problem statement, they used to write such kind of the literature, like we have conducted the study in the year of the 2000. So what is our outcome? What is our sample size? 30. So after in the 30, how much were gained? The above average, and the below average. So the last result was 66% or the 76%. So here the literature, they used to write the literatures. So here the literature review to search the best available evidence. This is the second step of the evidence-based practice process. So here, where essential and the relevant literature which will be related to our topic, and it is extensively reviewed. The literature review for the EBP must start with the theoretical and the clinical articles. So remember that whatever we are collecting the literature, that should be started with the theoretical and the clinicals. So mainly to have overview about the topic, which should be followed by a well-known existing of the evidence-based guidelines. See, it's better to include high level of evidences for a reviews, such like meta-analysis, systematic reviews like RCT, randomized control trials also we can able to use in the collection of the review of literature. It must be ensured that an extensive literature review will be carrying including electronically available in the literature. The reviewer who is going to review the literature, the reviewer must be aware, must be careful about the facts which was given in the literature, because sometimes we used to see, because sometimes in the articles it appears to be precise and the factuals on the surface, but with the further and the much closer examination some flaws can be found. On the other hand, the article can be loaded with the optionized or biased statement that couldn't form a such kind of the particular relevant findings to our study. By that, we ourselves will be lowering the or credible, we are discouraging the quality of the article will be the lowering. Time management is also must ensured while taking the review of literature. It is the another factor which is very crucial information and the quality of the article. Information and the current and the fresh information should be gathered by the researcher. Evidence must be considered more important comparing to the previous one. So here whatever the literature we are collecting, that should be start from the theoretical and also it should be involved with the clinical. So the starting should be there and the ending should be, it should be it should be giving more higher priority than comparing to the older one. So this is the second step. Collection of the review of literature in general manner. Collecting the review of literature, like if you see for example what is my study, vitamins and the mineral deficiencies among mothers with the under 5 children. So what type of the review of literature reviews I have to find? So those who have conducted the study, those who have framed the literatures on the vitamins and the mineral deficiencies among the mothers with under 5 children. So I have to collect these kind of the reviews. Why same the related literature should collect means, so to search for the best available evidence. So this is the second step of the literature. So this is the second step of the evidence-based practice. So coming to third step of evidence-based practice. So here third step, first step is formulating a clear question which should be based upon the clinical problem. Second step is review of literature to search best available evidence. Coming to here, analysis of strength and weaknesses of evidence. So here analysis means evaluating. We can able to call analysis means generally in terms in our general language we used to call it as also evaluating our strength and the weakness of that evidence in terms of the validity or generability. Use of such kind of the rating systems to determine the quality. The research is very crucial to develop our evidence-based study. There are the several rating scales to analyze the weakness and to analyze the strength. There are the different kind of the rating scales. Rating scales means like we can, if we enter into the statistic, we may understand the what is mean by the rating scales. So that will be proposing to determine the validity and like strength and the weaknesses of our study, our available evidences. So here it will be showing the rating scale will be showing the more practical rates, like how the literature is located, how the literature has been done, how the problem statement has been done, what are the clear question was done by the clinical setting. This step is one of the most challenging issues in our research study. Like here clinical questions should be framed. When forming a clinical question, the disorders of the diseases and the interventions of the findings should be reviewed. Like once literature is located, it is helpful to classify the once if we got the particular strength of the study, then it is to find the different kind of the classifying the articles. Systematic research we can able to find by before reading or critiquing the research. It is very useful for the theoretical and the clinical. Same here, analyzing means evaluating the strength and weaknesses. For example, I have conducted the study, I have gathered the evidence based practices regarding my problem statement, vitamins and mineral deficiency. So here my expert or my guide will be analyzing what is the strength of my study and what is the weaknesses of my study, whatever I have gathered the evidence. So that is the third step of the evidence based practice. Then coming to the fourth one, use of best evidence in clinical practice. So here, like use means implementing what we have planned. Generally our nursing diagnosis, nursing care plans, assessment, diagnosis, planning, assessment, diagnosis, goal, planning, rational, implementation and the evaluation. So here the planning means we have planned, just plan. Then coming to the implementation means already we have used whatever we have planned. So means already we have fulfilled our plannings. So here the use of best evidences in the clinical practices, implementing the useful findings in our clinical practice, that should be based only on the valid evidence. Evidence will be used alongside clinical expertise and the patient's perspective to the care plan, like nursing care plan. Once our study plans, our study findings were analyzed for like strength and the weakness, the internal and the external validity, like they used to observe the internal and the external validity. A decision will be making by the appropriateness of the evidence for the particular questions which is initiated for the evidence based practice. The final evidence, whatever we have selected the strength and the weakness, the final evidence must be extensively, so the evidence should be discussed among the users with the risk benefit ratio of the evidence, like what are the levels of the harms will be involving with the particular kind of the evidence. Means here the using complete information gathered should be interpreted according to the criteria and should always be shared with the other nurses or other fellow researcher. So this is the using of the best evidences in the clinical practices. Then coming to the last and the final step, fifth one, evaluating the efficacy of empirical evidences. It is the last step, finally after the implementation. Efficacy and performance evidences through a process of self-reflection, like self-assessment. We used to, the researcher, him or herself, evaluate regarding her study. Final after the implementation of the useful findings for the clinical practices or clinical procedures or some other public practices, performance will be evaluated through the process of internal and external or the self-assessment process. So here last step means conclusion. We have last step, generally we used to conclude the topic, conclude the particular kind of the program. Conclusion, the recommendation. So here the evaluation should be derived from the results. So here in evaluation what we used to get results, and it will be, the results will be based on the results. The researcher will be able to judge whether the data and the hypothesis should be applied to the nursing practices or not. So that should be based, that will be, the nursing practices will be based upon our study results. See, in generally if you are you have to remember these kind of the steps. So if you are not at all remembering the steps, first step, general manner selection of topic, first step. Then coming to the second one, form a team, means literature, review literature. And the third step is the analysis. And the fourth step is the best evidence. So you have analyzed, the expert has analyzed, either it may be strength or either it may be weaknesses. So here coming to fourth one, best evidence from these two evidence, from these two strength or the weakness. So here the researcher will be selecting the best evidence. By that best evidence, evaluation. Got it? So these are the steps of evidence based practice. Listen here carefully. Just generally, if you are not at all remembering the steps, formulating a clear question which will be based upon the clinical problem. Second step, literature review to search for the best available resources. And the third step, analyzing of the strength and the weakness of the evidence, using of the best evidences. Then fourth to last and the final one, evaluating. If you are not at all remembering, just remember, first step is selection of topic. Second one is review of literature, and the third one is analysis. Fourth one is best evidence, selecting of the best evidence, and the fifth one is the evaluation. See here, the researcher should select the particular topic. So after selecting the topic, what is our in the thesis second chapter? Review of literature, gathering the particular literature which was written and established by the experts. Then the third one, analyzing. So whatever the positive strength and whatever the weakness of our study, here it will be analyzed by our experts. Then best evidence. So by observing these strength and the weakness, the researcher should select the best evidence from these analyzed strength and the weakness of our study. At last, after selecting the best evidence, then immediately evaluation. Evaluation means the results will be coming, like how the hypothesis, how the framing, how the conceptual study, how the like methodology. So here the evaluation will be given by the our experts. This is the process of evidence based practice, or the steps for the process of evidence based practice. Then coming to the last and the final one, barriers of evidence based practice. So see here, barriers means obstructions or the obstacles will be coming. So for each and every program or for each and every organization, such kind of the activity, if you are performing a little activity, there will be raising of such kind of the barriers. Let's see what are the barriers for the evidence based practice. So the first one is the lack of professional ability. So here there is the researcher, or there are the many of the barriers to promoting the evidence based practices. Nurses mainly, see here, before going to the what are the steps. So here nurses must be aware of barriers surrounding, like regarding around our circumstances, both within their professional group and more generally in the health and the social services. Nurse should be aware regarding the around the circumstances within their places, professional activities, and within the health and with the some of the people. See here, the first one is the lack of professional ability. Like critically appraised research. This includes having a considerable amount of the research evaluation skills will be having a very low, and that should not be assessed for the like clinical or the hospital support should will not be for the researcher, and they will not give such kind of the spending of the time, means professional ability will be losing there. Then coming to the second one, lack of knowledge regarding the research method. It is also one of the most significant barriers in promoting of our evidence based practices. Lack of support. So see here, lack of support means example, we are conducting the study. So if we are having many people support, like our research guides, research partners. So if we are having the support only, then we can able to move on step by step. So if you are not at all having the support from any other, so the study can't able to move forward. So here the lack of support from the professional colleagues. Mainly the support should be there by the professional colleagues and the organization. Then next one, lack of time. Lack of time means the researcher doesn't know how to maintain the particular time management. So by that there is a lacking of time. Then lack of continuing education. Like programs for the nurses in India, especially for bedside nurses. bedside nurses, that evidences are not reaching to the nursing users, lack of continuing education. So see here, no one knows that continuing education means while doing the work, while continuing our work profession only, they used to continue their education status. So here many of the nurses were not having the aware regarding the continuation of the education. So here there is a lacking. Bedside nurses do not have will to implement change regardless of the benefits to the patient care. These are the 5 barriers. And then coming to the next barriers, shortage of research in some areas of the nursing. So here it is the most important. See here, we used to observe which is usefully and not usefully. We used to identify the effectiveness of the nursing care. Generally, in other words, whether a particular nursing activity works or not, or effective. There are many reasons for this, including time, resource that will be undertaking, the type of research needed, such as a control trials. So by that they can't able to know the particular this kind of the subject is there, and these kind of the research will be performed by the researchers and the evaluators. There is no knowledge regarding the particular kind. So by that shortage, lacking of research in some areas of the nursing. So only not coming to the it is no, I am not at all including the community people. So here mainly including the nursing only. There are some people, some areas of the nursing students or the nursing professionals or those who are working in the medical streams, they are not at all having the knowledge of the research, means shortage, lacking of the research in some areas of our nursing. Then the 7th one, lack of initiatives among nursing leaders. So here it is also one of the most important barrier, like they doesn't create the environment. So to manage or practice, the junior staff are scared to suggest their older superiors to implement better newer evidences in the clinical practices. Yes, it is also, we know that the juniors can't able to advise the superiors. So here there is a one of such kind of the egoistic minded. So by that there is a lacking of the initiatives. Then the 8th one is the physician dominance in the clinical practice. The nurses are not given autonomy, means freedom to the implement newer better clinical nursing evidences in our practices. So mostly the physicians will be dominant the nurses, so during our clinical practices. And the last one is the lack of administrative support. Administrative support means they doesn't give any incentives, they doesn't give any such kind of the new initiatives, new implementation. By that the administrative support will be losing the administrative support. So these are the barriers of the evidence based practices. So once again repeat with me. First one is the lack of professional ability, lack of knowledge, lack of support, lack of time, lack of continuing education. And the 6th one, shortage of research in some areas of nursing, lack of initiatives among nursing leaders, physicians dominance. Generally we used to observe physicians dominance, lack of administrative support. So there is no, nowadays we are not at all seeing that these administration, these institution is supporting for us. So mostly these are the barriers which will be occurring or conducting for the study during the evidence based practice. So what we have discussed the evidence based nursing, evidence based medicine, evidence based practice. So evidence based practice will be mainly locating, applying, appraising the so within the evidence of the medical and the nursing terms. Then coming to the steps. So I told that selection of the topic, review of literature, and the third one is the selecting the best evidences. Then 4th one is the analyzing the evidence from the positive, weaknesses and the strength of our evidence. Then evaluation. And coming to the purposes, we have seen the purposes and the barriers. So this is the important question for the BSc Nursing 4th year students. The question will be coming, write in detail about EBP, evidence based practice, or define evidence based practice for 2 marks, or write the steps, or write the process of evidence based practice. So either it may be come for the 5 marks. Thank you everyone. If you like my videos, do like, share and subscribe for more updates. Thank you all.